Why do doctors say that there are no good treatments for Festoons and Malar mounds? Welcome to Dr. Scheiner's Medical Minute. Today we're going to talk about why other doctors are not treating Festoons and Malar mounds and why doctors say there are no good treatments for Festoons and Malar mounds. Festoons and Malar mounds are difficult conditions to treat. Many surgeons, when discussing these conditions with their patients, tell them that they can't be treated. One of the best options is using ablative laser skin resurfacing to treat these malar mounds and eyelid festoons. Unfortunately, many physicians don't have experience with ablative laser skin resurfacing. The heyday of laser skin resurfacing was in the 90s, and many practitioners with varying degrees of experience were trying to use these machines. The main laser wavelength at that time was the CO2 or carbon dioxide lasers. This laser had great abilities to resurface skin, but left a sizable amount of heat behind in the wound after treatment. This resulted in long healing times, extensive redness to the skin, and occasional scarring. These complications were more likely with those physicians who didn't have good initial training in lasers and dermatology. When I trained in my fellowship, I trained with a giant in the field of laser cosmetic surgery, Dr. Sterling Baker. He was the first to publish on the use of lasers for cutting skin safely and started the field of laser blepharoplasty. In my training with him, I was exposed to many different types of lasers. In the middle of my training, he brought into the office a new type of laser for skin resurfacing. This was the Erbium wavelength. This was unique because more of its energy was able to be put into the skin in ablation and less behind as heat after the treatment. This led to safer outcomes and less complications. Festoon was the company that perfected this technology and developed a dual-pulsed Erbium laser that was tunable. It could be aggressive or gentle depending on the need of the surgeon during the surgery. This tunability made it very useful for helping many types of patients and skin conditions. Unfortunately, this company was late to the product life cycle for laser skin resurfacing, and as a result of issues with CO2 laser complications by often unsophisticated physicians, the marketplace became less interested in ablative laser skin resurfacing. Laser companies adapted and were forced by market forces to develop new ways to use lasers to help patients and their skin. They moved toward non-ablative lasers and Fraxel. These lasers, unfortunately, were never able to deliver the kind of results that were achieved with laser skin resurfacing. As a result, since that time, laser skin resurfacing, though very successful, had fallen out of favor. I often wonder what would have happened if Erbium resurfacing and Festoon's dual pulse laser technology developed earlier in the 90s. I suspect that this safer laser would have resulted in less issues with complications and more powerful results as well. This might have meant that many physicians would still be doing ablative resurfacing today. Unfortunately, today's surgeons aren't interested in learning about laser skin resurfacing because of their memory of past problems. Had they learned on the Festoon machine years ago, they would likely love laser skin resurfacing. So I think the reason why many doctors don't treat Festoons is because they are inexperienced with the lasers used to treat them. I've quietly built my skills over the past decades so that now I have extensive experience treating Festoons and Malar mounds with lasers. It would be possible for today's surgeons to learn this, but most don't want to bother and are more interested in learning other procedures instead. I'm happy, though, that I do have the ability and interest to help patients with these difficult to treat conditions. I really love what I do to help my patients and the impact I have on their lives afterwards. If I can be of help to you or someone you know, please contact my office. I hope you found this interesting, and I invite you to come back and watch again for our next Medical Minute. Goodbye for now, and I wish each of you a beautiful day.